The Surgeon General recently declaring it a public health epidemic as more and more Americans are reporting an increase in loneliness and feelings of isolation. Health experts say that there are some major health threats here, with loneliness increasing the risk of premature death by 26% and social isolation by 29%. Those findings may disproportionately affect Americans who often face more barriers to mental health treatment. Joining us live this morning with guidance on supporting aging loved ones and their caregivers battling loneliness, we have Dr. Paul Geiger with Providence Health. Hello, doctor. How are you this morning?
I'm very well. Thanks for having me.
So talk us through the Surgeon General's recent report on the loneliness epidemic, and what are your big takeaways here?
Well, really, the biggest takeaway for me about the Surgeon General report is how prevalent an issue this is. The survey data research shows about 1 in 2 Americans are reporting significant levels of loneliness. And the concern is that, as you mentioned, this is linked to significant increased risk of both mental and physical illness.
So talk to us about how this could disproportionately impact older adults.
Well, older adults in the surveys, up to 40% of them are reporting significant levels of loneliness. And because there's an increased risk of physical and mental illness in this population, we know that older adults are already starting with an increased rate of physical and mental illness. And so it's really just kind of a double whammy for them. The older population has challenges at times around isolation. They're more likely to live alone, transportation challenges, technology challenges. And so it is a particularly concerning population for us.
So this next question, twofold for you. How do we support loved ones that may be dealing with some of this isolation? And two, if you don't have people in your life, how do you kind of work to get yourself out of those feelings of loneliness?
Yeah, I think, starting with the first one, if you have somebody in your life who you are concerned is lonely, obviously reaching out to them in any way you can. We have technology, you have the phone, a little bit goes a long way. And for people who get out of practice, I really think, an incremental, slow step-by-step approach where they're just kind of starting, really baby steps. Maybe that's getting coffee with somebody or just getting out in public and being around people. You don't have to necessarily socialize. Going to the library, going to a cafe, just getting out and being around people has been shown to increase the feeling of connectiveness that you have with other people.
Do you have any recommendations on resources for any further mental health treatment when it comes to fighting isolation or feelings of loneliness?
Yeah, at Providence Health Plan, we really emphasize the importance of our members having a strong connection with their primary care physician, having a relationship with somebody over time who knows you, who can understand what's normal for you is really important. And if you're not feeling well, get an assessment. Meet with a professional and ask the question, I'm not feeling right. A primary care physician is capable of assessing people for common conditions like depression and anxiety, and often have the tools available to treat you for that. And if not, if it's beyond their scope, they know the local resources and the local landscape that they can refer you to the help you need.
Dr. Paul Geiger, thank you so much for your time today.
Thank you. Happy to be here.